Well, I want to get some input from the audience real quick. Hit the button. So quick show of hands. My farm fam. Show of hands, who has spoken to someone, could be a colleague, family member, anyone, about the RSV vaccine? Show of hands. So almost every table in this room, except for the middle table,
Great.
I wonder what y'all work in, has talked about it. So I want another question. I want to hear one word that comes to mind that you hear from patients about the RSV vaccine. One word, and I will start. Skepticism is what I hear, oftentimes with people. One word.
Confused.
Confused? Anyone got a word?
Suspicious.
What was that?
Suspicious.
Suspicious. What over here? On one word.
Scared.
Scared. This is very optimistic.
Political.
Political. We're getting warmer.
Unsure.
Unsure? All right. We're going with it. What about over here? One word.
Why?
Why? Well, sorry. Whoa.
Nonchalant.
Nonchalant. So no one is like excited. We're saying, yes, we need to get this done. So here's another question I have. What do you hear? What are the misconceptions or the thoughts or the questions you actually hear from patients? You said why. I'm curious.
It's funny, I've actually had patients who are not the population that should be getting it, who want it more than the population who should be getting it. So that's probably the most interesting thing that I find, is that the younger generation, people in their 40s and 50s are like, can I get that? And people in their 60s are like, another vaccine, really?
That's fascinating. That makes me think there's confounding variables. Maybe it's health literacy, maybe it's people paying attention to awareness and should direct on where we're going with our education. Who here has something they've heard from patients about a question or a perception or something? Anyone here have an example? Something they've heard?
There's one right in the front.
Where?
12 o'clock.
12 o'clock. Super curious. What is something that you've heard?
I was just going to say people are much more likely to get the vaccine if you let them know it's going to keep them out of the hospital, or more likely to keep them out of the hospital, that is.
So like an incentive, which goes into my next question of what tips or what has worked in talking to people about the RSV vaccine?
I think that just educating people about what's going around in your own community is really helpful, and helping them to understand, we have a really great healthcare system as far as if somebody gets sick, they can go into the hospital, get treated, and be fine. But in those chances, in those situations where the hospital system is overwhelmed by, say, like an influenza A outbreak running rampant, that's going to occupy most of your hospital beds. So whenever somebody shows up with a really bad case of, say, RSV, there's not just like a whole lot of room for them, and that scarcity can be a little bit scary, and sometimes they don't have any idea that it's going on. So the more education you can provide about what's going on in your community is really helpful.
Are you an educator? Do you work in communication? Because that was fire. I mean, people, I hate to say it, are inherently selfish, but when you show them that there's a public health impact or there's an indirect effect, to your point, I think it does make a difference. Who over here has a tip for the up-and-coming educators and communicators of the world? Bring the noise. You can answer whatever question you want.
Okay. Well, I think it helps to personalize it to the patient. So like in the case where that person had COPD, you could say, because of this, and bring it home to them.
Meeting the audience where they are. Amazing. Before I toss back to our experts, I'll tell you the one thing that's always worked for me is I often hear, well, why is the vaccine coming out now? Are you guys in bed with pharma? Who's doing it? Is it political? And to explain to patients why it's taken so long to develop one, kind of unveiling that scientific mysticism helps as well. We have a lot to talk about. I'm excited for our next round of audience interaction because this group is engaged. Don't worry, I'll bother the next side over there next time.